Hi everyone, I am Samit Kumar. Today I am going to present you about the ameloblastoma. What is ameloblastoma? Ameloblastoma is a benign cancer. Sometimes it can be a malignant type. What are the clinical features of ameloblastoma? Its sign and symptom is mainly happening in the lower jaw, in the mandible region, and facial area is called maxillo area. This is called maxillary area. That maxillary bone is there. Sometimes it can be spread to the even nasal bone also. Clinically, it's a hard swelling. Hard means like a bone enlargement like this. Main problem is facial deformities can happening. These are the ameloblastoma, that clinical features. That enlargement of mandible we can see outside. This also we can see that maxilla part also involved. That mouth is deviated to other side. When it spread the ameloblastoma, it can compress the facial nerve. That it can cause the facial palsy also. Then this is a severe condition. This patient, this is lateral view, is severely extent of the ameloblastoma, bone rupture. That this is a front view. This is another type of person, not this patient. It's an intraoral examination. We can see hard bony enlargement of the retromandibular area on the lower jaw. Just behind the third molar area we can see this is a intraoral examination mirror. Then this is also another type of patient. It's also sometimes buccal surface of the mandible is extend to the buccal surface. It's also retromolar area, that mandibular region. Then this is also ameloblastoma clinical picture. It extends at lingual surface and mandibular area. It can compress submandibular salivary gland. Sublingual salivary gland is front of the lower jaw. Then other type of patient is also hard bony enlargement we can see. Then how can we diagnose? In clinically, we can palpate hard bony prominent and facial deformities. Then we can do X-rays. On the X-rays we can see radiolucency areas like this. In addition to that, we can do CT scan and MRI, magnetic resonance image, computer tomography. We can do. This is a surgical removal of the mandible, is called semimandibulectomy surgery. This X-ray show after reconstruction of the mandible, there's a mini bone plate fixed to that missing part. This radiolucence area is show another ameloblastoma type. That tooth are deviated and severely invasive of the mandible. These are the other type of X-ray. This is a lateral view of the mandible. It shows clearly another type of ameloblastoma. This is a occlusal view of the mandible. It's a lower occlusal standard X-ray. These are the histopathological view. Then one, we got a biopsy. Biopsy means taking a tissue part. It's sent to the histopathological lab. Then pathologists examine these tissues. is like this. It shows ameloblast cells. What is ameloblast? Ameloblast means those are the cells that produce dental enamel. The overgrowth of the over multiplication of the ameloblast cell cause the ameloblastoma. These are like this that histopathological features. It can be diagnosed by a pathologist. This is a microscope they use to examine. Mainly this is a surgery going on. That this surgery is done by oromaxillofacial surgeons. There are different types of surgeons: orthopedic surgeons, general surgeons, eye surgeons. Like that, this area is specialized in the facial area. This is known as oromaxillofacial surgeons. This X-ray is a OPG X-ray. It's an orthopanogram view X-ray. It's a normal dental X-rays using. These are the other special investigation. We can do full blood examination. We can use EDTA tubes. Then we can use fasting blood sugar level of the patient. Use chloride tubes. Then we can do another type of investigations. We can use SSC tube like liver function test, TFT, LFT, like that. These are the biopsy bottle. These are not collected by a phlebotomist. This is collected by a surgeon in the theater. There are different type of biopsy bottles.